It's 2 a.m. Your baby is screaming. Their little face is red. Their legs are pulled up tight. You've tried everything and nothing works. You feel helpless, exhausted, desperate for anything that will help. I know that feeling. And today I'm sharing 3 simple remedies that actually work to stop baby gas and colic fast. These techniques have helped thousands of parents, and they can help you tonight. Stay with me because remedy number 2 is the one most parents get wrong. First, let's understand what's happening. Baby gas is when air gets trapped in your baby's tiny digestive system. They can't release it on their own yet. It builds up. It causes pressure. It hurts. Colic is more intense. It's when your baby cries for hours, usually at the same time each day. The crying seems impossible to stop. Here's what you need to know. This is completely normal. Your baby's digestive system is brand new. It's still learning how to work. Most babies go through this between 2 weeks and 4 months old. You're not doing anything wrong. Your baby isn't broken. They just need a little help. And that's exactly what these 3 remedies will do. They work with your baby's body to release the trapped gas quickly and safely. Let me show you how. Remedy number 1, the bicycle legs technique. This is the fastest way to release trapped gas. And it works almost immediately. Here's why. When gas gets stuck in your baby's intestines, it needs help moving down and out. The bicycle legs technique creates gentle pressure that pushes the gas through. It's like giving your baby's digestive system a little workout. Here's exactly how to do it. Lay your baby on their back on a soft surface. Make sure they're calm, not right after eating. Take both of their legs gently. Now move them like they're riding a bicycle. Push one knee up toward their belly. Then the other. Back and forth in a smooth rhythm. Do this for about 30 seconds to 1 minute. What should you expect? You'll probably hear some rumbling sounds from their tummy. That's good. It means the gas is moving. You might hear toots. That's even better. That's the gas coming out. Your baby's face will start to relax. The crying usually stops within a few minutes. Why does this work so well? The movement massages the intestines from the inside. It gets everything moving in the right direction. Plus, the gentle compression helps push the gas out. You can do this technique several times a day, especially when you notice your baby pulling their legs up or getting fussy. It's completely safe and natural. Remedy number 2, proper burping method. Most parents burp their babies, but many don't do it correctly. And that's when gas problems get worse. Here's the truth. Every time your baby feeds, they swallow air. That air needs to come out. If it doesn't, it travels down into their belly and causes pain. Burping releases that air before it becomes a problem. Let me teach you 3 positions that actually work. Position 1 is over the shoulder. Hold your baby upright against your chest. Their chin should rest on your shoulder. Support their bottom with one hand. Pat or rub their back firmly with the other. Not too soft. You need real pressure. Position 2 is sitting up. Sit your baby on your lap. Support their chest and head with one hand under their chin. Lean them forward slightly. Pat their back with your other hand. Position 3 is face down. Lay your baby across your lap face down. Make sure their head is supported and turned to the side. Rub or pat their back in circular motions. How long should you burp? At least 2 to 3 minutes in each position. Don't give up after 30 seconds. Sometimes it takes time. When should you burp? During feeds, not just after. Pause halfway through the bottle or breast. Burp them. Then continue feeding. Common mistake? Parents pat too gently. You need firm, steady pressure. Another mistake is giving up too quickly. Be patient. That burp is coming. Remedy number 3, tummy massage. This technique is called the I love you massage. And it's incredibly effective for moving gas through your baby's system. Here's how it works. You're going to trace letters on your baby's belly that follow the path of their intestines. This helps push gas and stool in the right direction. First, make sure your baby is calm and hasn't just eaten. Wait at least 30 minutes after feeding. Warm up some baby oil or lotion in your hands. Now for the technique. Start on your baby's left side of their belly. Use 2 or 3 fingers. Draw the letter I downward. That's 1 stroke down their left side. This is the descending colon. Next, draw an upside-down L. Start from your baby's right side. Move across their belly under their ribs. Then straight down their left side. Finally, draw an upside-down U. Start at your baby's lower right side. Move up, across under the ribs and down their left side. Repeat this sequence 5 total times. Use gentle but firm pressure. You should see their belly moving slightly. Use clockwise circular motions too. This follows the natural flow of digestion. The best time to do this? Before bedtime or during a calm moment in the day. Never when your baby is crying hard. The benefits go beyond gas relief. This massage also helps with constipation. It promotes better digestion overall. And it creates bonding time between you and your baby. Let me give you some extra tips that make a huge difference. First, feeding position matters. Keep your baby's head higher than their stomach while feeding. This helps air rise up instead of going down. If you're bottle feeding, tilt the bottle so the nipple is always full of milk. No air bubbles. Tummy time is crucial. Put your baby on their belly for a few minutes several times a day. This puts natural pressure on their tummy and helps push gas out. Plus, it strengthens their muscles. Now, when should you call the doctor? If your baby is crying for more than 3 hours straight and nothing helps. If they have a fever above 100.4 degrees. If they're vomiting forcefully or have blood in their stool. If they're not gaining weight or seem lethargic. These could be signs of something more serious. Let's talk about what doesn't work. Gripe water might help some babies, but it's not proven. Avoiding certain foods while breastfeeding rarely makes a difference unless your baby has a true allergy. And most babies don't. Don't restrict your diet unnecessarily. Gas drops with simethicone can help break up bubbles, but they're not magic. These 3 techniques I taught you are more effective and completely free. Let's recap what you learned today. Remedy number 1 is the bicycle legs technique. Move those little legs to push the gas out fast. Remedy number 2 is proper burping. Use the 3 positions I showed you. Burp during feeds, not just after. And use firm pressure. Remedy number 3 is tummy massage. The I love you technique follows your baby's intestines and moves everything along. Here's what I want you to remember. You're doing an amazing job. This phase is temporary. Most babies outgrow gas and colic by 4 months old. Some even sooner. It won't last forever, even though it feels like it will. Be patient with your baby and with yourself. Try these remedies tonight. Give each one a real chance. You'll find what works best for your little one. And please ask for help when you need it. Hand the baby to your partner. Call a family member. Take a break. You can't pour from an empty cup. If these remedies helped you, share this video with another exhausted parent. We're all in this together. You've got this.